Welcome to Be Well with MS podcast, where we delve into the complexities of living with multiple sclerosis and explore the latest in care and wellness. Today, we are thrilled to have Dr. Leo Russell with us, and he is a principal clinical psychologist at the Devon Partnership NHS Trust in Exeter. Dr. Russell brings a wealth of experience, particularly in neuropsychology and adult psychotherapy, with a focus on medically unexplained symptoms. His journey began at the University of Plymouth, where he earned his doctorate in clinical psychology, learning to hold a both-and position that emphasizes the integration of research and critical psychology perspectives. Dr. Russell's career has been marked by a deep commitment to working in collaboration with service users, and he has a particular passion for intensive, short-term, dynamic psychotherapy, which has revolutionized his approach to treatment. Today, he will share his insights on functional neurological disorder in the context of multiple sclerosis, helping us understand the connection between these complex conditions. Dr. Russell, thank you for joining us today. So welcome to this episode.
Thank you. Thanks so much for inviting me.
Before we dive in, I want to remind our listeners to visit www.BeeWellwithMS.com and subscribe for the latest updates and resources and episodes like this one. So now let's start, Leo. I just want to explore a little bit this really complex topic that we as neurologists, as MSologists, see in our clinics, patients having organic problems such as multiple sclerosis with a variety of different neurological symptoms. But at the same time, we also see some emerging symptoms and signs that would be classed as functional neurological disorder. It's such a label that sounds very dramatic in a way, but I just want to sort of understand a little bit, and if you could give us a little bit explanation, what is the functional neurological disorder?
Sure. Well, it may be helpful if I start more broadly even with, what are functional symptoms? These are experiences which we all have one way or another because it relates to the way in which the body is functioning. So it interacts in particular with the world and with our physical systems in our body. So this is one reason why they could be confusing. Unlike some other medical conditions, these symptoms aren't just about structural abnormalities or structural damage in the body, but really about the way in which we're responding to the world, in which we may not even be aware of. So we've all experienced some kind of functional symptom in our life. Perhaps you've had the experience of preparing for an exam or going to a medical appointment or going on a first date. And in those circumstances, this will be generating some level of nervousness, perhaps, and then you might notice yourself getting a dry mouth or getting increased heart rate, or your muscles might tense up. So these are all very normal experiences, and they are what we might call functional symptoms. But for some people, under some circumstances, we can experience more severe kind of functional symptoms. So at higher levels, for example, of anxiety and stress, we can start to experience symptoms in our stomach. So we might get diarrhea or constipation, or maybe we might start to get symptoms of sickness or dizziness. And then at higher levels still, we start to see symptoms which we might think of look more like neurological symptoms. And so it's for these kind of symptoms that someone might be sent to a neurologist. So let's say they're presenting with a tremor, or they might have some kind of weakness in their muscles, or they might experience some kind of collapsing, or perhaps seizures. They're sent to the neurologist for these to be looked at, but it turns out that these aren't being caused for this particular person by brain damage or brain disease, but much more to do with this relationship between the mind and the body. So that's what we would call functional neurological disorder, FND. One important thing here is that there are multiple causes of FND. Some of these causes have their roots in psychological functioning, but there are a variety of ways which FND can be generated or triggered. So I'm going to speak today largely from the perspective of what psychology and psychotherapy can bring to the understanding of FND. But I do want to highlight that it's important that when we're looking at treatment for FND and people with functional symptoms, that we understand that this is best placed within a multidisciplinary system where people can benefit from treatment, not only from neurology in the case of FND, but from occupational therapists, physiotherapists, speech and language therapists. So we're drawing on a range of different holistic approaches for how we can work with people's health and well-being. So pathways in healthcare trusts for FND should focus on building a multidisciplinary approach, of which psychotherapy and psychology is an important part of that. But as I say, today I'll be speaking mainly from the perspective of psychotherapy and where, for some people, emotional factors can play a role in the development of their FND.
Yeah. I just want to understand what is the behind the scenes, what happens in our minds consciously and subconsciously? What is sort of the foundation? Where's it all coming?
Yeah, so this is a great question. And I think probably a good starting point is, as with most things, we really only know some of what we'll eventually know. So there's much more which we'll find out. And what we know right now is that there are multiple potential causes of functional symptoms and of FND. But what we can say is that for many people, these symptoms can be caused by adverse experiences or difficult relationships with their emotions, which effectively generates anxiety in the body. And so anxiety is something which we all know about, but we don't ever really taught about what anxiety is. And one thing that we can say about anxiety is that it's something which manifests in the nervous system. So if I could take a moment maybe to describe some of the different levels of anxiety, and that might help us to think about how we could go from feeling completely normal one moment to the next moment having quite strange or unusual symptoms. If we go back to the first moments of life, to when we're born as babies, we all have feeling systems hardwired into us that are adaptive for us in one way or another. So we have some basic feelings such as grief, rage, loving feelings, guilt, some variations of those feelings, which are there right from the start. And these are adaptive because they signal our needs and help us to get our needs met in the relationship with our parents. So, for example, when a child or baby is separated from its parent, it will experience something which we might call grief, which is an unpleasant feeling. We all know grief feels unpleasant. And so that unpleasant feeling itself will motivate the baby to stay close to dad or mum. But should the parent be separated from mum or dad, then this will cause the feeling of grief to arise, and then the impulse of grief, which is to cry, which is a distress signal. And when the parent is able to tolerate the child's feelings themselves, then that parent will then be able to go to the child, and you'll have what we might call a reunite experience for the child. So its needs are met in that moment. And as the child gets older and older, they gradually learn to tolerate more of their feelings of grief themselves as the parent titrates how quickly they go to the child. And so this way in which we learn to regulate our feelings is true for all these what we might call these core attachment feelings that we experience. But for some children, they may have an experience with parents who either for a temporary period or because of what they've learned in their lives are having difficulty tolerating their own feelings. So when the child's feelings are mobilized, this causes the parent's feelings to be mobilized. And if the parent can't manage their own feelings, tolerate their own feelings. They might withdraw from the child. They might become harmful to the child. Perhaps they become fearful, or they can't tolerate the child having any distress at all. So they go to the child immediately and try to make it immediately okay to stop it from crying. In these circumstances, for the baby, their feelings are no longer helping them to get their needs met. In fact, it's causing ruptures in the attachment, which is a threat, which is dangerous for them. So we need another system that can override the emotions, that can help change that baby's behavior. And this system is the anxiety system. So it's a bit like top trumps if you ever played that at school. Anxiety at a certain level trumps feelings. So when you're feeling a certain amount of anxiety, you can't feel your feelings anymore. So feelings here get conditioned with anxiety for the child. So whenever the grief or rage or love is mobilized, then it just causes anxiety. And the child is only aware of experiencing anxiety in that moment. But we're smart creatures too, because we stumble across behaviors that alleviate the anxiety, and unconsciously we automatically learn to do these behaviors more and more. There are all sorts of different examples of these behaviors. One example might be that the child learns to focus on the parent, or maybe learns to keep really busy to avoid their feelings. And this being the case, these things get conditioned together. So before long, when the unconscious feelings are activated in the child, all that can be observed is that they get really busy, and the child themselves won't be able to notice the feelings because these are being kept at bay by the behavior. And it's all automatic. So this itself may never be too big a problem unless something happens later in life which mobilizes a greater amount of these mixed feelings, and or prevents the usual defenses from operating effectively. So in the first case, let's say maybe that child grows into an adult, and then in adulthood they go through a divorce, or they lose a parent, or maybe they find love. And in any of these situations, what might happen is it causes a greater dose of feelings to be activated. This overcomes their previous tolerance that they developed, and causes massive anxiety in their body. Another thing that can happen is if the defenses are compromised, so maybe the person who learned to keep busy and focus on others, maybe they have an operation, they're bedbound for 2 weeks, they can't do that anymore. So as they're lying there, all these feelings are coming to the surface, which they've been keeping at bay for years and years, right? And complicated feelings too is worth saying. It's very complicated. Feelings of anger towards people you also love creates massive guilt, and it's very difficult for children who haven't been given the opportunity to learn their feelings are okay. So in both these situations, we see anxiety going into the body because it's been conditioned to the feelings that are now coming up. And the anxiety can go into different parts of the bodily systems. So the first place this can go is through the sympathetic nervous system and the somatomotoric nervous system, where what you would see is what we might call fight and flight. So maybe you might be familiar with the idea that the heart rate can increase, you can get tension in your voluntary muscles, get dry mouth, dry throat, these kind of things. And this itself isn't a problem if we're facing a temporary danger. So if you step into the road, you see a car coming and your heart rate increases, you get a bunch of adrenaline, your muscles tense up, you jump out of the road, the car goes past, and then your body starts to relax again, goes back to a resting level. That was really helpful with that anxiety. But if your sympathetic nervous system's anxiety is conditioned with feelings and the feelings aren't processed, then you'll be getting chronic anxiety in this tension in your muscles, and that's going to have a consequence. You're going to become fatigued, exhausted. You may develop pain in particular areas of the body. So for some people where emotional processing is the cause of their symptoms, this can account for functional pain disorders or functional fatigue disorders. And then if higher levels of anxiety are mobilized by the feelings which are coming up, then you can get other kinds of symptoms. You can get acute or chronic spasm in the bladder, blood vessels, airways, digestive tracts. And this can cause a whole bunch of symptoms for people, which can be sort of functional gastrointestinal disorders or functional migraines. Maybe for some people who have IBS, this can be a cause of their symptoms. And then at higher levels of anxiety, where the threat the person experienced in the face of their feelings was even greater, then they may have a more extreme response where the parasympathetic nervous system, which is normally used for rest and digest, is co-opted as a sort of an emergency stop. And this looks something like a kind of freeze and flop response. So some of you may have cats, and you may have seen when your cat is chasing a mouse around the kitchen. First of all, its fight and flight is going and it's running. And then if the cat gets the mouse in its mouth and the mouse can't escape, then what we can see is the mouse plays dead. It goes floppy, right? Now, this isn't an Oscar-winning performance. This is an extreme parasympathetic response. And as I say, we have corollaries of this in us as humans. So under extreme anxiety caused by the mixed emotions, what you can get is a loss of muscle tone. You can get weakness. You can get loss of voice. You can get collapsing, and you can get certain kinds of functional seizures. So it's this latter, more extreme anxiety that, for some people, can be a cause of FND symptoms.
So unsolved emotions that can manifest to the physical signs and symptoms.
Exactly. Yeah,
okay.
Exactly.
So we are sort of keeping that sort of at the bottom, not releasing. And I remember as a student, one of the psychiatrists told us, he was lecturing at the time, and he said, what's not expressed gets depressed. So sort of it, and I always remember that saying. And we, as a human beings, we tend to hold things, and not, expressing and telling to other people or to ourselves, not bringing that awareness, when we are feeling anxious. Perhaps maybe first step would be to say, I'm anxious, I'm worried. But somehow we sort of find a way and excuses to hide that, and sort of which is not helping, right? So at all.
That's right. Exactly. I mean, ultimately, it's a very weird being a human, right? So we sort of come into this world, and lots of things are going on around us, and we have to adapt to what's going on around us. And for all of us, we couldn't go around expressing our feelings all the time. That would get us into quite a lot of trouble, potentially. But if we've been through those experiences where, like you say, we've learned to repress our feelings, and that's become automatic, it's when we don't even know we're doing it, it's automatic, it's habitual, then over time, that is going to have, as you say, these consequences for us. And apart from the fact that it can have physical consequences, it can also mean that we can find ourselves pretty compassless in our life. So if we're not connecting to our feelings, then it's harder to know what we want. And if we don't know what we want, then we can be living our lives in ways that don't work for us. And that itself can create further stress and misery and upset. But these things, as I say, they're consequences of our body evolving at a time in history when survival was the important thing. And if it helped you to survive, to repress your feelings, then that was better than expressing your feelings, if you see what I mean. Mm-hmm. So it's adaptive for us to be able to repress our feelings for some time. But when we do that chronically, then we pretty soon feel the cost.
Yeah, and we can explain that these sort of how these emotions and feelings play the role in our bodies. If we analyze the primate brain, which is our brainstem, it's a fight and flight response that goes into amygdala, which is our emotion holder, and then we have a prefrontal cortex, which is it sort of analyzes your experiences. But somewhere in between the circuit, there must be some sort of a problem for some people who are prone to have functional symptoms. And we quite often label this as a functional overlay. Can you help us to understand what the functional overlay means, in particular when we're dealing with the chronic conditions? What does that mean? Is it the same as functional neurological disorder? It's just a definition to describe that used quite widely in medicine between the healthcare providers.
Yeah, so usually it does mean something quite distinct. And part of the dilemma here is we distinguish between functional symptoms on the one hand, where what we're saying is the mind is playing a major role here, and organic symptoms on the other, where what we're saying is that the body is playing a major role. And of course, what we know in practice and what you know as a doctor who sees patients is it's much more complicated than that. The mind and the body are linked really for every health problem we might have. It will involve the mind and the body in some way. So this is the first thing to say, that it's not quite as simple as functional and organic, right? There is some kind of spectrum there. But when we say functional overlay, what we're sort of describing is something which there is the original symptom might exist as a consequence of the structural damage in the body or disease process. So let's say for someone with MS, they might have an original symptom of fatigue. But it could be that the degree of the fatigue they're experiencing is more than might be expected for that person, given the particular picture for them. In which case, we might say, well, are there other psychological processes going on that are adding to the original symptomology and making the fatigue worse? So here we might say, this is caused by functional overlay. It's like the combination of the original symptoms and then the emotional, psychological, and mind response to those physical symptoms.
I would like to emphasize that all the feelings and experiences in this life in our bodies are valid, are legit. They are real experiences. We should avoid sort of definition to say, oh, this is in your mind, only in your mind, and people get frustrated and upset about this. And they sort of sometimes come to my clinics and say, oh, my GP doctor said it's in my mind, and they really feel that they're not being listened, that they're being sort of given label that they imagine this is imaginary sort of experience. How can we overcome that? Living with multiple sclerosis, I'll give you a bit of also background. That's my day-to-day work, is that people imagine they are in their 20s, 30s, 40s. They had good life before the MS started. And then suddenly they develop limb paralysis. They can't walk, they can't do anything properly for a period of time. Then they have a recovery period. They sort of overcome the deficit and disability. The way I see it, they almost like experience like PTSD type, and then grief of the lost life that they had before, because fewer patients would go back to their baseline. Majority of people still have a residual ongoing disability and deficit. How does that sort of play from the psychology perspective, from the way that the MS can influence functional neurological symptoms, if at all? Do you see the link, how it's all sort of playing on people's minds, and how should we be aware of that? And maybe in particular people who are newly diagnosed, how to bring that sort of understanding that this is the fact. Yes, the disease comes in, it's a chronic, usually not curable. They have to now live for the rest of their lives. From the psychology perspective, how should they sort of implement strategies maybe to overcome that sort of immediate shock and then live with this?
So I think what you're describing there, as I understand it, are number of different normal human reactions to going through extremely difficult experience. And first of all, I think one thing that it's making me think about is just recognizing the emotions. And partly that's about allowing yourself to feel the emotions when they come up. So if you're experiencing grief about loss of expectation, or grief about how tough it is, what you're going through, allowing yourself room to have that grief and knowing that the grief is on your side, right? It's there because you care about yourself, and that allowing yourself to experience it means that it will feel less intense over time, and it allows you to act on that grief as well. This is the other part of feelings. It gives us an idea about what we want to do. So, for instance, it might mean that you decide to prioritize certain things in your life because you're recognizing this is really important for you at this point in time. Now, equally, it's also okay to give yourself time away from your feelings, to say, look, I've been feeling a whole lot of grief, but do you know what? I just want to go out and I'm just going to go for a walk for 10 minutes and forget about it. Or I'm going to put on a Netflix and watch a film or something, or just say to a friend, I need you to distract me. We need to just talk about something else for a while. That's okay too, right? And so giving yourself permission to be aware of your feelings and interact with them and process them, but also allow yourself distraction as you need that as well. I'm a particularly big advocate of the nature of conversation. We have psychotherapy as formal points where you can have conversation with experts, and that's obviously out there for folks who need it. But many of us also have good friends or good family members or carers who we can speak to, and where just having a conversation, just putting out there the worries that are in our mind, means we're not bearing that on our own. In particular, if it's with people who know us, right? It can really help if we've been impacted by our health condition, to speak to people who know us now, but maybe knew us before the health condition was there. They've got a sense of our history and an understanding about how that might impact us. So I really feel like connecting to other people, allowing ourselves to connect to ourselves, and taking care of ourselves are some of the key things in terms of how we can respond in that kind of situation.
Yeah, and bringing that awareness that if I feel unwell, I know I feel unwell. If I feel well, I know I feel well. So each time, right? So you sort of you analyze, because we are so good at analyzing other people, and we quite often forget about ourselves. How are we feeling this moment? You can actually, for the listeners, you can do this practice now as we speak. How are you feeling? Do you have a tingle somewhere? Do you have a headache? Are you thirsty? Are you hungry? So, and do that practice very regular. I think that could potentially teach you to sort of analyze your own body requirements and express them when the need is. And remember, we are social creatures. We like to socialize. We like to express ourselves. We like to share experiences. And I think this can be very therapeutic. And going to people who really knows you very well, whether it's uni mates, school mates, doesn't matter, family members, it doesn't matter. But having that regular contact, I think, overall, in the long run, is going to nourish your body, your soul, and uplift your spirits.
Very well put. Exactly. And something I'd add to that, is we're all really just sort of children in big adult clothes. And sometimes it can help to think about ourselves like that. Sometimes we treat ourselves in ways we wouldn't dream of treating our children or other people's children or us as children, right? So think about how can I be kind to myself? Now, that doesn't mean that you would never push yourself. You might push yourself to do something, but it affects the tone in which how you push yourself, right? So it's a difference between saying, why aren't you doing this? You should be able to do this. You're being lazy. All the kind of horrible things we wouldn't dream of saying to someone else. We might say to ourselves, I know you've got this. This is hard. If you don't quite make it today, then we'll have another go tomorrow. But let's give this a go, right? the difference between how you'd speak to yourself and how you'd speak to someone else sometimes is huge. And if you catch the way you talk to yourself, and you try and speak to yourself in a generous, supportive, encouraging tone, that can make a difference on its own.
Wonderful strategies, I think, to take into account and really follow that advice that comes from Leo. So my sort of a question here, thinking about broadly, I think that education is super important, and maybe there are some available resources for patients or anybody with a chronic condition to link in and sort of explore a little bit strategies and self-help management living with functional neurological disorder. Are there any sort of charities available? Anything to share for the audience?
Yeah, absolutely. So when it comes to FND, there's a really great website, neurosymptoms.org, which has been established for quite a long time. And there's plenty of things on there in terms of understanding the different symptoms, the kinds of treatments that are out there. So I'd highly recommend that. There are also some excellent charities. So in the UK, in the Southwest where I work, we have FND Friends, who are doing really terrific work, peer support in the local area. They go as far up as Gloucestershire and as far down as Cornwall. And for folks sort of internationally or wider in the UK, there's FND Hope, which is both national and an international charity. And again, on their website, there's lots of things you can access around understanding the condition. And the other thing, particularly with an FND, it's been a community where it's been really driven forwards by patient advocates. So folks who have had first-hand experience of living with FND, who are really helping us as a whole field to better understand FND, better understand how we can support people living with functional symptoms. And so there's lots of stuff out there. On, if you're someone who can go on Twitter without getting addicted to it, then you can have a look on Twitter, or X as it's now called, or Instagram. There's plenty of stuff out there with people with lived experience, which is important. And that reminds me, and you were alluding to this earlier, Agna, one of the things that people often say about their journey with FND is that they can feel like they're not believed. So they can feel like they're being told it's all in their mind, or the symptoms aren't real. But I think this is where it really helps to talk to either the experienced clinicians or other people who've lived with the condition, because it really helps you to see, no, these are real symptoms. They're really happening in your body. They're not your fault. You're not going mad. This is just the way your body's reacting. And there are all sorts of different causes of that. So reaching out to these communities is something I would definitely recommend.
Yeah. And as neurologists and healthcare provider, our role is to really distinguish what is MS and what is the functional neurological disorder. We are trained by getting a lot of information throughout our training days when we become neurologists. We really know how to distinguish functional neurological disorder versus MS. But sometimes, I have to admit, it's very, very fine line. And it's difficult sometimes to say which symptom, which underlying cause is dominant in a single person, because it can be both, and then maybe one as you mentioned before, the fatigue, which is the commonest symptom of multiple sclerosis, and then if it is mixed with emotions and feelings, and there is a functional overlay, so it can enhance the experience for the patient living with the fatigue. But also it becomes very challenging for us as neurologists to distinguish which is a cause that is dominant, causing more fatigue. And I think it doesn't overall changes our management that much. We would still look at the patient as a whole and provide some sort of a holistic general rules what to do if you feel fatigue, which is have a good night's sleep, drink a lot of water, avoid all the sugar, exercise, and see what happens in a way. But there are some sort of mental health illnesses, depression and anxiety, and that requires some therapeutic approaches. So a lot of people are on antidepressants, I would like to sort of delve a little bit whilst we're talking to you, Lo, about the intensive short-term dynamic psychotherapy. I class this as a treatment approach, and it's emerging evidence-based therapy following your recent presentation and meta-analysis results, which you are part of the co-author. Can you explain a little bit about this sort of a type of psychotherapy? Because I believe that there are numerous amount of different psychotherapies in this world, but this one specifically that is attracting a lot of attention these days. Tell us a little bit more about this.
Sure. So this approach it was developed starting in the 1960s by Habib Davanloo in Canada, who's a psychiatrist over there, and it was supported and further developed by David Malan in the UK. And then other colleagues since have further developed the model. And its main focus is how we can help people overcome their difficulties in the fastest amount of time possible. There's also a safe way of doing that. So it's become particularly helpful for people with functional symptoms. So people who are having physical symptoms. And the reason for this is because it's a therapy which is experiential. So it's about the experience of emotions, of anxiety, of the way that our body is functioning in relation to our past experiences, our current experiences. And so what we're looking at in ISTDP is where we can see there's a connection between unprocessed feelings, anxiety, and habits which have become automatic in repressing and keeping the feelings away. So perhaps it's helpful if I give a kind of an example about how we might work with someone who's presenting with a functional symptom of some kind. If someone comes in to therapy and to the assessment and they're experiencing perhaps migraines as their main symptoms. So we know in ISTDP that one of the causes of migraines for some people are what we call smooth muscle tension, which is when we get activation of the smooth muscles, which happens at a certain level of anxiety. We know that activation of the smooth muscles also causes symptoms such as acid reflux or nausea, sickness, urgency to go to the loo. So what we would do initially in a session to see if there is a link between the feelings and the symptoms is we'd invite the person to pay attention to their feelings to do with a recent situation. Maybe their boss has shouted at them at work. So you say, how do you feel towards your boss for shouting at you at work? And then you observe with the person to see what happens in their body. And if they experience anxiety in this smooth muscle group, so maybe if they start to feel sick or nauseous, or they experience cramping in their stomach, then we might say, oh, well, this is interesting. This is the smooth muscle anxiety group being activated, and we know this is related to migraines for some people. So there may be a link here between your emotions and your symptoms. So this is, if you like, it's a way of identifying where therapy could be helpful, but also it's a way of identifying where perhaps it might not be helpful for the person if there is no link. And then if it turns out that there is a link and the person's we're happy to work together in therapy, then the focus of the therapy will be on trying to explore the unprocessed feelings that are being triggered for that person at this point in their life that might be causing the symptoms. So you could think of it almost like a sort of emotion phobia therapy. So where people have experienced anxiety gets connected with their emotions, they then can't process their emotions. So we help them to track what's happening in their body, to regulate their anxiety so that it's more at tolerable levels and not going into the functional symptoms. But then when we do that, as the emotions come up, because of the way the mind works, as we're feeling certain feelings, memories come up that are connected to those feelings. This is sort of the semantic networks in our brain. So those memories come up connected to those feelings in our life, And then we explore the feelings and help the person to process those in relation to those memories. And this effectively decouples the feeling from the anxiety and then resolves the functional symptoms for people where emotion processing is playing an important role there.
I see the potential as well as, I'm just trying to understand whether this short-term dynamic psychotherapy is also effective, not just for functional neurologicals, but some people who are depressed, who are anxious, who are experiencing panic attacks. Who are your patients? What conditions are they coming and they responding very well? Is this short-term dynamic psychotherapy for everyone, or there are a category of people that would respond better than the other?
So ISTDP is it's not a panacea for everyone in that respect, but what we do see is it's a highly effective treatment across mental health conditions and functional conditions. Now, the initial phase which I described, where we're looking to see if there's a connection for that person between their symptoms of migraine in that case and anxiety and emotions, you can do a similar thing in relation to, say, depression. So someone if we think about, well, what are the symptoms of depression? Well, often the symptoms of depression are flatness, fatigue, lack of sleep, usually critical self-thoughts, self-attack, that kind of thing. Mm-hmm. So what would happen in that case, as you go with that person to look towards their feelings, what you start to observe is they will start to go flatter. They'll feel more tired. They'll feel a loss of energy, but also maybe they start to become more self-critical, more self-judging. Maybe they start to feel more hopeless, right? So those are what we would say in ISTDP are defenses, ways that the body is repressing the emotion by going to hopeless or self-attack or fatigue. So we start to see that for that person, we could say, well, yeah, it looks like there could be a link here between this person's depression and this person's symptoms and their emotional processing. One thing I think that's really important with this, why ISTDP has been so effective in healthcare services, is because it's not diagnosis specific, it's problem specific. And so for quite a few people that I've worked with, what we find out is they may have a separate diagnosis of depression and a separate diagnosis of anxiety and maybe a separate diagnosis of chronic fatigue. But what we discover is that for this particular person, that all those symptoms of the anxiety, depression, and the chronic fatigue are being caused, or at least perpetuated, by emotional functioning. So in those instances, we say, well, look, the good news is these aren't three separate problems that we have to treat in three separate ways, that these are interlinked problems. And if we can address the emotional processing, then we can find that if the problems resolve, then, well, the proof is in the pudding in that respect. It also works, funnily enough, it can work the other way. I've worked with people who've been presenting with functional symptoms of one kind, of various kinds. We do the treatment and 6 out of 7 symptoms completely resolve. Mm-hmm. And then you're left with one other symptom and you say, well, this appears this symptom isn't related to emotional functioning. So we go back to the doctors and we say, look, mm-hmm. let's find out, is there something that we've missed that's been going on for this person? But always we would practice ISTDP following diagnosis and medical investigation to make sure that, we're working with people where there's a question about could this person's symptoms be a result of their emotional functioning, and other causes have been ruled out by that point.
This is fascinating. I think our body is, the way it functions, everything is linked and connected. There's interconnectedness between the emotions, feelings, our underlying conditions, chronic conditions, diseases, MS, and emotions and depression, and all. And it's fascinating to see that with one single therapy, you can manage to cutting the right branch, you can manage to solve a lot of problems, and that's really impressive results. That if we only manage to achieve that by introducing the psychotherapy, which I'm a strong believer. I think everyone in this world living such a busy, stressful lives, everyone should have psychotherapists or psychologists. There is a difference between psychologists and psychotherapists, right? They also is this therapy available in the NHS or it's purely private?
So there are some places where it's available in the NHS. It's very much a growing therapy in the UK and I suppose in other countries too. So you may find that it's available locally to where you live, but if not, it's certainly available privately. And people can also access this therapy sometimes over using video technology as well, rather than being face-to-face. So there are different ways of accessing it. At the moment, as you know, with these kind of things, it's really important that we're training people up to be able to practice, and that we're researching these in larger scale ways. So we're really demonstrating the efficacy to make the case for implementing these approaches. So where I am locally in Exeter, we have clinicians using ISTDP, obviously in FND services, but also I have colleagues using ISTDP in ICU, using ICD in adult mental health. Using ISTDP in adult mental health services, in children's services. I have colleagues using it in inpatient services. Really to great effect in all these areas. And it's particularly important, I think, that one of the challenges for health services when it comes to psychotherapy is that we've got treatments which have a range of mechanisms of change. So treatments that do different things that can help different people. So, for instance, we've had a really effective rollout of CBT across the UK, as we've had in other countries. And what we see with the outcomes of that is that for mild to moderate mental health presentations, of the people who finish treatment, it helps about 50% of them in resolving their symptoms, which is great. If you think about that's usually 8 hours sitting down having a conversation with someone, 50% of them have reduction in symptoms. That's a terrific outcome. But what about the other 50% of those people with mild to moderate symptoms or people with severe symptoms? We need other models that offer other ways of trying to help people. And this is where models like ISTDP can really come in, because the way ISTDP works isn't only based on our thinking, on our cognition, but also based on the way we experience our bodies, our visceral experience, our emotional experience. So by combining those things, that is what makes ISTDP particularly effective for groups that have found they haven't been able to benefit from other therapies.
Wonderful. Last question around this therapy is how to find the best psychotherapists. The reason why I'm asking this question is a lot of around people get maybe a 5-day course online and they pretend to be psychologists these days, as you may be aware. There must be some accreditation and licensing process that you can check the psychotherapist or psychologist running the services and running the psychotherapy sessions, whether they are accredited psychotherapists. Where to find this information, Leo?
Yeah, thank you. That's a really good question. So all ISTDP clinicians, bona fide clinicians, have done a training program that was accredited by IEDTA, the International Experiential Dynamic Therapy Association. We use lots of very long acronyms, which are very difficult to remember, so I apologize to everyone for that. But so you're looking for someone who has done a training program, completed a training program with IEDTA, and it's worth having, have a conversation with that person. Look at the information they have on their website to make sure that they've got experience in the area that you're looking for help with, whether that's mental health or functional symptoms, or adjusting to health more broadly. So those are the things to kind of check out to make sure you're working with someone who's bona fide. And the other thing is all ISTDP clinicians have a prior professional training in a particular profession. So if you're seeing a psychologist in the UK, you want to make sure that they've been registered with the HCPC. If you're seeing a psychotherapist or a therapist, you want to make sure they're registered with either BACP or the UK CP. I think I've done all the letters of the alphabet now, so I'll stop there. But it's a really good question. I think just want to make sure the person you're seeing is experienced and appropriately qualified.
Yeah, wonderful. And just to make a note that functional neurological disorder is widely spread across multiple specialties, neurology, and the rest, oncology, gastroenterology, you name it. And there are some functional neurological disorder disease clinics available. We have in South Devon 2, one based in Plymouth, one in Exeter, and I'm pretty sure there are multiple other areas where the multidisciplinary approach is being provided to people treating with functional neurological disorder. And as you listen our conversation, people do come having chronic conditions and mental health illness. There is interconnectedness between these multiple conditions, chronic conditions. So, Dr. Russell, thank you for the enlightening conversation and for sharing your expertise on functional neurological disorder, covering such a wide range of the issues living with FND and in relation to multiple sclerosis. Your insights not only deepen our understanding, but also enrich our approach to health and wellness in phase 2 multiple sclerosis. To our listeners, we hope today's episode has been informative and inspiring as you navigate your journeys with multiple sclerosis. Remember, every step forward is a step toward better health and understanding. For more information, resources, and to make sure you never miss an episode, visit our website, www.BeeWellwithMS.com, and subscribe for the newsletter. Join us next time on Be Well with MS, where we continue to explore and learn and grow together. Until then, stay well and keep moving forward. Thank you, Leo, for coming.
Thank you.